So let's talk about the challenges of trauma and how shame fits into this picture. Mary Harvey, who with Judith Herman was co-founders of one of the first trauma clinics in the United States, used to say, trauma survivors have symptoms instead of memories. She was trying to reassure us, you know, when you're a trainee, when you're a social work intern or a psychology pre-doc, you're still very anxious because truthfully you know nothing. So, it's not a bad time to be nervous. And of course, we were nervous. We were working with people who couldn't remember what happened to them, but their symptoms suggested that whatever it was really, really bad. And so we learned to make educated guesses based on the symptoms as to what might have happened. Not that, of course, we could share that. It's not that we would say to someone, well, your symptoms are suggesting to me that you've been sexually abused. But it was a way to understand and make meaning of what these clients were bringing. And one of the most important thing I teach my clients is that a traumatic event is just an event, no matter how sadistic, malevolent, and dark it is. At the end, it's just an event. What makes traumatic events leave long-lasting, lifelong imprints is the legacy of symptoms. Just as Mary Harvey said, all the symptoms that we normally associate with major depression, as well as symptoms we associate with PTSD, symptoms we associate with shame and self-loathing, with anxiety disorders ranging from OCD to all kinds of phobias to social anxiety. Substance abuse and eating disorders are also highly correlated with trauma, and as well as suicidality and self-harm, and dissociative symptoms and disorders. And actually, I left one very important legacy out. Also, borderline personality disorder is correlated with a history of trauma. And Judy Herman taught me, and she taught me so well that I really believe it still today, to see borderline personality as an Axis I trauma-related disorder, not as a personality disorder, which makes it a lot easier to treat, I can assure you. Now, this, by the way, is the first page in my psychoeducational flip chart, which you'll see outside at the book counter. And the version I show clients is a little simplified, but it usually is a very reassuring start to a psychotherapy. Because rather than asking them what happened to you, right, which would be the events, I ask them, do any of these symptoms look familiar to you? And often they get a good laugh over that. They say, ha, familiar. Why don't I just tell you the ones I don't have? It'll be so much quicker. And some, I remember at the end of one assessment visit, after going over this, the man at the very end of the session as he was leaving, suddenly out of nowhere hugged me and said, thank you for teaching me that I'm just having normal reactions to an abnormal situation.